I am basically working in Gurgaon, Delhi NCR, especially in South Delhi and also Faridabad. I am available at Fortis Hospital, Vasant Kunj, and Fortis Hospital at Faridabad also. But my primary station is at Fortis, Gurgaon. I have been operating, I have been doing surgeries for the last 20 years now. And I have been with the Fortis Hospital for the last 10 years almost now. I deal with surgical problems in children right from birth up to their 18 years of age. In this topic, I was asked to choose for a specific disease, but I thought since it's my first interaction with you, I will go with a general topic of what exactly pediatric surgeon does, what exactly pediatric surgery means, and some common conditions which require surgery in children. So as I told you, I cater to surgical needs of children right from their birth up to their 18 years of age. Most of the time you will be seen by your local pediatrician, and when as and when they find a surgical problem, they will refer you to your nearest pediatric surgeon. As such, any child, if he has a problem, any sickness, we get so much worried, and it actually skyrockets. It just bombards us when we find that the treatment is going to involve a surgery in a small kid. The entire topic, the next 20 minutes that I am going to spend with you, I am going to try to reconsole you, try to tell you that surgery in children in today's time is very safe, very successful, very pain free, with excellent recovery. So you need not worry if you have any kind of problems for which a surgery is required in your child. I am going to take examples of a few cases which are going to be mild but very common in our practice. I am going to leave aside the major cases, probably for some other discussion, probably for our next interaction. I have been practicing for the last 20 years, and honestly, I have realized this, and this is a well known fact, that children tolerate surgery far better than adults. The reason being their organs are good, kidneys is working fine, heart is fine, liver is fine. So the recovery in children is very good. With the advancements, a few of which I will be discussing in details, the recovery in children is even faster than their adult counterparts. The anesthesia part, the thing that most parents are worried about the most, is also very safe in today's times. Let us just start with some examples which we very commonly encounter in our practice. So, one of the commonest problem in children, if you ask any pediatric surgeon, the commonest surgery that they perform is a hernia. Now, many parents ask me, hernia bachon mein? But yeah, it is true. Hernia is one of the most common surgical problem in children. And it is a very good example for me to tell you how things have changed and how things are different between an adult and a child. So a child is not a miniature adult. He's not a small adult that you can deal with in the same way. Their disease process, their body physiology, their functioning, everything is different. And that is why we have a specialized branch of pediatric surgery or a pediatric urology who deals with them, because that is something that they do far more commonly. So I have not touched an adult for a very long period of time now, and I only deal with children. So hernia in children is basically a very small opening in your groin. It is more commonly known as inguinal hernia. Inguinal refers to the groin region. So a small opening in the groin from where your intestines start coming out. So it is not opening on the skin, it is inside the skin, the muscles, where there is a small opening from which your intestines start coming out. This opening is present since birth. It is the opening from where your testes have come down. Your testes develops inside your tummy, and when the child is inside the uterus, at that time the testes, they come down and lie in their normal position. These openings, they tend to get closed when the child is born, but in some cases they tend to remain open. And if they are open when the child strains, for example, he's coughing or he's crying a lot, if he's putting strain while passing stools, at that time the intestines, they protrude out as a small swelling that you will see in the groin region. This is one of the most commonest problem that we see in children which requires a surgery. Now, these hernias are different from adults. In adults, it is because of weakness of your tummy wall and not because of this opening. And so the treatment is also different. So in children, you just need to put a simple small stitch. A single stitch is good enough, which closes this hole and your intestines stop coming out. The swelling completely goes off and your child is perfectly fine. It is a daycare surgery. And by daycare, I mean the child is admitted in the morning on the day of surgery and is discharged in the evening. So you don't even have to stay overnight. The process itself just takes around 15 to 20 minutes. And when it comes to anesthesia, the anesthesia also will last only for 15 to 20 minutes. So the children, they go to sleep when we are doing the surgery and come out immediately once we have done the surgery. They don't remain under anesthesia for a very long period of time, and that is true for most of our surgeries. So pediatric anesthesia means anesthesia for children has also come a long way, and that has made our job very easy. And the children, they don't require a very prolonged stay in the hospital because the anesthesia is so safe nowadays. So the hernia itself will require just 15 to 20 minutes. Probably the child will stay in the operating theater for less than an hour and will be back in your arms. We have such good modalities of pain relief nowadays that you will hardly feel that the child has undergone any surgery. The commonest complaint that I get from the parents after this surgery is कि बच्चा तो बहुत उछल कूद कर रहा है, क्या करें? And I say that is absolutely normal. बच्चे तो उछल कूद करेंगे, and that is what we want. We want the child to be absolutely pain free, and that is how we can provide that. Now, I was talking about some recent advances in this field of surgery in children. So this is another example. Surgery for hernia can be done with an open incision, although even for hernia, the cut which is given is very small. But we have now further advanced into laparoscopic surgery in children as well. So we are able to do this surgery through laparoscopy. Laparoscopy means we have three tiny holes which we make in the tummy, which are just 3 millimeter in size. So you can understand how small 3 millimeter is. And through that, we put a scope and we do the surgery with laparoscopy without actually putting any sort of a cut or a big cut in a child. The results are even better. The recovery is even faster. Maybe for some other diseases, the difference is very stark. So when you have a stay for 4 to 5 days for an open surgery, sometimes we are able to convert it into 2 to 3 days because we have done it through a laparoscopy. So this is an example of how we can give your child a very pain-free recovery after any kind of surgery. So this was just an example. I will give you a few common examples that we deal with in everyday life. For example, another condition is when you have a hydrocele where water collects around your testis and there is a swelling in the scrotum. Similarly, in some children, the testes may not have come down to their normal position, which we call as an undescended testis. These testes also need to be brought down to the right place because the development of the testis is dependent upon their right position. So these also require a minor surgery. Then in certain cases, the children are unable to pull their prepuce back up. That is called as a phimosis. Prepuce is the foreskin over your penis or over your genital organ, which should normally retract. But sometimes they may not be able to retract it properly and can cause minor infections on and off. And in such cases, the children will require a surgery called as the circumcision. Then there are certain conditions which may not always be surgical. For example, constipation. Constipation is mostly related to your diet, but at times it can have a surgical problem also. The disease is called as a Hirschsprung disease, and it requires a surgical correction. It's only once your constipation is not being treated with your proper methods that you then think of there may be some other cause, and then you are sent to or referred to a pediatric surgeon who investigates with a few tests, comes to a diagnosis, and then tells you about the surgery. Similarly, recurrent urinary infection. If you have a child who is having infections again and again, he develops fever, he has pain while passing urine, the urine does not look good, it's turbid and cloudy, then that most likely is a recurrent urinary infection. Some of these cases, of course, will have some problems which are present since birth in the bladder or in the kidney, which may again require a surgical correction. So sometimes these common problems also have a surgical origin, not always, but yes, in a few cases. Similarly, blood coming out from your anus is another example. Another common surgery that we perform is acute appendicitis. Now, again, the parents ask the same question, appendicitis in children, and I tell them appendicitis is very, very common. We operate almost 2 to 3 cases, 4 cases, almost a month, which is a huge number. So appendicitis is another common problem. Again, things have changed. Earlier, we used to have a huge cut with appendix, which used to get infected. The recovery was slower. And nowadays, we do it frequently with laparoscopy in any age group for that matter. And we get a very fast recovery in cases of acute appendicitis also. So these are some common examples. I am going to enlist a few cases which are there in the children, common in children, which we normally don't see in adults. I'm not discussing details, probably keep it reserved for some other talk, but just to give you an example of what sort of case we deal with when we have surgical requirement for children. So many of them are since birth. For example, some children can be born without a food pipe, means there is no esophagus or food pipe. The pipe which delivers our food from our mouth to the stomach may be absent in a few children. Then there may be a gap in the intestine in some of the children. There may be some children who are born without any opening for stool, so they cannot pass stool. There is no opening, and we have to do surgeries for these children. Fortunately, these kind of conditions are rare comparatively, but yes, they will require a surgery, and trust me, they have very satisfactory outcomes despite them being really, they sound really harsh, but finally you get a very good result. Similarly, sometimes you have problems in your liver. Your liver is not able to excrete the bile or its own secretion, which is called bile, normally into the intestine. It may be because the pipes or the ducts which take this bile into the intestine are not fully developed, or they have become small in size or small in caliber, or there may be a swelling in these ducts which is not letting the bile to pass through. So it is called as a biliary atresia or a choledochal cyst, which may cause jaundice in the child. And sometimes when you have a child with jaundice, your pediatrician can refer you to a pediatric surgeon to deal with these kind of conditions. Similarly, there may are various problems in kidneys. Commonest one of them being a swelling in the kidney. Many a times while you are pregnant, your ultrasonologist may tell you that there is a swelling in the child's kidney, and this child may or may not require some kind of intervention. So fortunately, 1 in 500 cases will land up, only 1 in 500 will actually land up with the surgery. Most of these swellings will resolve on their own as with passage of time. But once in a while, these cases also will require a surgery. Similarly, there may be problems with the bladder. The bladder may not be able to keep the urine well into itself, and some urine may be going back towards the kidney. All the urine that comes from the kidney should stay in the bladder and go out only, but sometimes the urine may go back. And these children, of course, are the ones who get recurrent infections in the urine. So recurrent urinary tract infections are ones where surgery is required. Similarly, there may be a blockade to the passage of urine, something called abnormal valves or posterior urethral valves, which does not allow the urine to come out of the bladder very normally. And these may also require some kind of an intervention. Then the intestines may be twisted in a wrong manner. That is called as a malrotation, may result in the child coming back again and again with vomiting. So sometimes vomiting may be medical, but occasionally or rarely it may be a surgical problem also. So these are the common kind of things that we go through in pediatric surgery. Apart from this, in the chest also, sometimes you have some cysts which are formed in the lungs. These cysts may be because of some kind of an infection, and some of these cysts may be present since birth. Again, these may also require surgery. Some of the common things that you might have seen around you is a cleft lip or a cleft palate in which there is a defect in the lip. In these cases also, they require some kind of a repair so that these gaps are closed. So cleft lips, cleft palate, sometimes there are small swellings over your face, over your neck. There might be small openings on your neck. These are all common problems that a pediatric surgeon will help you out with. I will tell you about the recent advances. Nowadays, we are moving more and more towards minimally invasive surgery, means laparoscopy. That means going through small, tiny holes in the tummy rather than putting a big cut. And a similar kind of thing is called thoracoscopy when you do it in the chest. So for lung conditions, you can do thoracoscopy where you put very tiny cuts, small 3 mm or 5 mm cuts, through which you cameras, and from the camera you see inside and you put tiny ones inside and do the entire surgery, which gives you a very pain-free experience after the surgery. The recovery is really, really fast in these cases. Lot of things we can do endoscopically, in which we don't even have to put small cuts. For example, I told you about a condition where the passage of urine is blocked. In this condition, you can actually take a small tiny scope which are now available and go in through the penis, through the passage of urine only, and do the surgery. Don't even give a cut outside. Similarly, you can go through the mouth and enter the food pipe, or you can go through the mouth and enter your airways also. So sometimes when a child has accidentally put in something in his mouth which has gone into his airways, for example, a peanut or a small nut or sometimes even a coin, and has got stuck there, we can just put in a scope and remove it rather than giving any sort of a cut. Nowadays, when robotic surgery has come into picture, robotic surgery is similar to laparoscopic surgery. The only thing is that the instruments are handled by the robot. The robot in turn is handled by the surgeon. So it has a lot of benefits. It eliminates the tremors which is associated with an operator handling the instrument. It makes our jobs very easy because you are sitting and operating on a robot. The precision is very good. Your job becomes easier and the results are good. We are one of the first few centers in India who started pediatric robotic surgery, and we are regularly doing robotic surgery in children as small as 5 months, 6 months also. And we are providing these children with very satisfactory results. So your recovery time and the time required to stay in the hospital after surgery has tremendously decreased. Not to mention, there is hardly any scar, there are just small openings, and through that, you get a very good cosmetic result also. Anesthesia has also grown leaps and bounds. There are hardly any complications of anesthesia in today's time. The children, they wake up after the surgery immediately in most of the cases, and the pain that they experience are very well managed with a lot of maneuvers that we do. We put in some catheters, we give some modes of drugs, which is very safe, and they give excellent pain relief. In short, we ensure that your child has a very safe passage through surgery and recovers well, smiling, without any anxiety, without any panic. In the end, I would just like to summarize my whole talk by telling you a few very small things. Surgery in children is very, very safe. You don't need to worry about it. Anesthesia in today's time has advanced so much that you don't really need to worry about any sort of complications. The technology has advanced so much that we can do a lot of surgeries with minimal kind of cuts, with minimal intervention, so that there is very little scar, there is very little pain, and the recovery is very fast. So in case your child has ever been prescribed for a surgery or sent to a pediatric surgeon, you can go there, keep your worries aside, and trust that things are going to be very easy. I am available on this portal for any kind of doubts that you have. You can have a chat with me. You can look out for further talks on this channel. And I can also publish my articles here so you can read about them and have your doubts clear. I am available in South Delhi and in Gurgaon. I am with the Fortis Hospital, Gurgaon. And you can contact me through this portal and I will be happy to help you out with all sort of problems. I welcome you all to have send me any kind of queries that you have. I'll look through the chat and see, and I'll try to answer as many as possible. Thank you. So I have a query. My baby is 1.3 years old, and when the baby is crying, uski नाभि में swelling हो जाती है. So this is called as an umbilical hernia. So this is one of very common problems that we encounter. अम्बलिकस वो स्पॉट है, नाभि वो स्पॉट है जहां से हमारी इंटेस्टाइन्स, जब पेट में होता है बच्चा उस समय बाहर डेवलप होती है इंटेस्टाइन्स, और जब वो वापस अंदर चली जाती है तो वो नाभि रह जाती है. दिस ओपनिंग अगेन क्लोज हो जानी चाहिए जब बच्चा पैदा होता है, बट किसी किसी में वो खुला रह जाता है और वो इंटेस्टाइन्स बाहर आती हैं. अगर वो इंटेस्टाइन्स बाहर आती हैं तो उसको अम्बलिकल हर्निया कहते हैं. 90% ऑफ द टाइम्स ये अपने आप वक्त के साथ ठीक हो जाता है. सो बाय 2 to 4 years ऑफ एज दे बी ऑल राइट. अगर ये फिर भी रह रहा है, परसिस्ट कर रहा है उसके बाद में, तो फिर कभी कभी सर्जरी की जरूरत पड़ती है. सो दैट इज लेस देन 10%. इसकी भी सर्जरी इज वेरी माइनर. डे केयर प्रोसीजर मीन्स सुबह आके बच्चा शाम को घर चले जाता है. हार्डली 15 से 20 मिनट लगते हैं. स्कार भी नहीं आता है. इट इज ऑल इनसाइड द अम्बलिकस, तो कोई स्कार भी नहीं आता है. बट मोस्ट ऑफ द टाइम्स हमें इसमें सर्जरी की जरूरत नहीं पड़ती है. इट इज अपने आप ठीक हो जाता है. So I have another query from and has said कि कोई तिल्ली बढ़ गई है. Now I will need to see the child to be exactly कि ये क्या वो है प्रॉब्लम है, and I can tell you whether इसमें सर्जरी की जरूरत है या सिर्फ मेडिसिन की जरूरत है. So kindly please consult with detailed ultrasound जिसमें कि मैं ये बता पाऊँ. Just with the swelling in liver, because there are many causes for swelling in liver, I will not be able to tell you exactly कि इसमें क्या issue आएगा. Okay, I have another consult from Mr. Archit saying that my son has bow chest issue. This is a relatively rare problem in which the shape of the chest is not normal. और जो हमारे चेस्ट में रिब्स जहाँ पे ज्वाइन होती है उसका प्रोट्रूजन हो जाता है जिसकी वजह से बो चेस्ट होता है. अगर ये सिवियर है, if your doctor is saying that it is severe, then of course that needs to be corrected. So इसको हम पेक्टस डिफॉर्मिटी बोलते हैं और इसका करेक्शन जरूरी है. बट हाँ, और डिटेल्स के लिए आई विल नीड टू सी द एक्सरेज ऑफ द चाइल्ड, एंड इफ अ सीटी स्कैन हैज बीन डन दैट आई विल हैव टू सी. सर्जरी के बाद में ये डिफॉर्मिटी ठीक हो जाती है, ये वाली प्रॉब्लम ठीक हो जाती है. देयर इज नथिंग टू वरी अबाउट. इट इज नॉट a very life threatening surgery and has excellent results. You don't really need to worry about it. So these were a few questions that I had from you. अगर आपके पास और भी कोई doubts हैं, if you have any kind of queries, आप मेरे साथ share कर सकते हैं, and I will be happy to help you out. Thank you very much. Thank you for spending time with me. Thank you very much.